In addition to being voluntary, ethically valid consent must be intentional. Intentional choice means the patient's decision is deliberate and reflective, not accidental, impulsive, or the product of confusion. This requirement protects autonomy by ensuring that the patient is not merely going along, but is genuinely authorizing a course of action with awareness of what they are doing. In clinical settings, it is common to mistake a quick agreement for intentional consent. A patient may nod, say, "Okay," or sign paperwork, yet still not be making a truly intentional decision. They may be overwhelmed by information, distracted by pain, fearful about outcomes, or uncertain about what they are actually agreeing to. In those situations, consent becomes more like a reflex than a reasoned choice. Intentionality requires that the patient recognizes three things. First, that a decision is being made, that this is not simply routine, but an action that carries consequences. Second, that there are real alternatives, including delaying the decision or declining the intervention. Third, that their choice is meaningfully connected to their own understanding of the situation, even if they ultimately defer to professional advice. A decision can fail to be intentional in several ways. It can be accidental, such as when a patient believes they are agreeing to one aspect of care but is unknowingly consenting to another. It can be impulsive, such as when a patient agrees in a moment of fear, anger, or desperation without adequate opportunity to reflect. It can also be the result of confusion, which may arise from medical jargon, language barriers, cognitive overload, sedation, emotional distress, or simply the complexity of the clinical problem. This is why intentional choice is closely linked to the clinician's ethical communication responsibilities. It is not enough to disclose information. Clinicians must ensure that patients are oriented to the decision in front of them. Ethical practice often requires slowing the conversation down, checking understanding, inviting questions, and creating space for the patient to think. Sometimes intentionality is supported by small concrete steps, asking the patient to summarize what they believe is happening, clarifying misunderstandings, or revisiting the decision at a later time when the patient is calmer or in less pain. Intentional choice does not mean that every patient must deliberate at length or make decisions independently. Patients may reasonably rely on professional guidance and still be fully intentional, so long as the reliance is itself chosen. In other words, "Doctor, I trust your recommendation" can be an intentional decision when the patient understands the stakes, recognizes alternatives, and authorizes that trust freely. Intentionality becomes especially important in high-stakes decisions. Major surgery, end-of-life care, participation in research, or decisions involving irreversible outcomes. In those contexts, consent must be more than a procedural step. It must reflect the patient's thoughtful authorization of what will happen next. Ultimately, intentional choice protects the integrity of autonomy by ensuring that consent is not merely an administrative yes, but an ethically meaningful act of self-direction. When a patient's decision is deliberate and reflective, consent becomes what it is meant to be, a genuine expression of agency in the midst of vulnerability.